Chapter 6 is the skeletal system. So we're going to talk about the skeletal system in the fact of what it does for our body, how we maintain homeostasis in our skeletal system, some of the functions and some of the structures of our bones, and several things we're going to get into on bone remodeling as well as bone formation. So some functions of the skeletal system, number one would be support. So that's the framework of the body. So without the skeletal system, your body would just collapse. It is very strong, but yet light. So we support our body. It is our main support system, obviously. So again, we protect. So number two would be protection, meaning that like your ribs protect, your heart and your lungs and your skull. The skeletal system, the part of your skeletal system being the skull, protects the brain. So protection of many internal organs, and the vertebral column protects, of course, the spinal cord. Number three, attachment sites for skeletal muscles. So facilitate movement by acting as levers when skeletal muscles contract. So here we need to understand that bones provide the structure for muscles to attach so that our bodies are able to move. So again, bones are no good without muscles, and muscles are no good without bones. Number four, hematopoiesis. Hematopoiesis is the formation of blood-formed elements, which is our blood cells, our red blood cells, our white blood cells, and our platelets that occurs in the red bone marrow. And then fifth function here is mineral storage, stores large amounts of calcium and phosphorus. So some shapes of the bones, we have long, short, flat, and irregular. Long bones are longer than they are wide, and they're mostly compact bones. So your femur and your humerus would be an example here. So these are capable of supporting and withstanding great deals of weight and pressure. Short bones, they're cube-shaped, mostly spongy bone. Now we haven't got into compact and spongy yet, but we're going to start talking about that in a few slides. But just from the name of it, you can go ahead and probably guess that compact bone is something stronger than spongy bone, and that is the case. So short bones would be like your carpals and your tarsals. So short bones, they're very limited in their range of motion, and they glide across one another. And again, they're cube shaped. So it's the little bitty bones like in the wrists and the ankles. Flat bones are thin and flattened, usually curved. External layers of compact bone around an internal layer of spongy bone. So your skull, your ribs, your sternum, and your clavicle would be an example of your flat bone. So they serve to protect soft organs and offer a smooth surface, very optimal for muscle attachment. Then you have irregular bones that do not fit in any of the other categories. So your vertebrae and your hip bones or your coxal bones would fall into this category. Now the structure of bones. Here we have three different areas that we need to talk about: the epiphysis, the articular cartilage, and the diaphysis. The epiphysis, that is the end of the bone. Now notice in the photo to the right, you see the epiphysis, and it is composed internally of spongy bone. So it has a rounded end, and it's basically the rounded end of a long bone. So it is initially separated from the shaft by a section of cartilage that eventually ossifies so that two portions fuse together. Then the articular cartilage, this is hyaline cartilage that covers the epiphysis, protects and cushions the end of the bone, covers the end of the bones where they come together to form joints, and it allows the bones to glide over each other with very little friction. Then you have the diaphysis. This is the shaft of the bone, composed mainly of compact bone, because the diaphysis is the main portion of the bone there you can see in the middle. It is what is withholding great strength, so it is composed of compact bone. So it's made of bone marrow and adipose tissue. And if you recall from chapter 4, adipose tissue is your fat tissue. So it's primarily moves the load from weight-bearing joint surfaces. Now we have the epiphyseal plate and we have the epiphyseal line. So the epiphyseal plate is a plate of hyaline cartilage that allows lengthwise growth in immature bones. So this is an area at the long end of the bone that contains growing bone. So these plates permit growth after birth, allowing the long bones of the body to extend and a person to grow as they reach maturity. So if you have not reached your mature adult height and you're still growing, then you have the epiphyseal plate in your long bones. Now, the epiphyseal line this is the remnant of the epiphyseal plate. So this is the line of fusion connecting the diaphysis and the epiphysis. So this is the part of the bone that replaces the epiphyseal plate once a person has reached their full adult height. Periosteum is the outside covering of fibrous connective tissue membrane involved in protection and repair, providing protection and blood to nourish the bone. So it snugly covers all the bones. It contains the attachment site for muscles, ligaments, and tendons. So for adults, the periosteum is responsible for forming new bone as a result of injury or infection. In children, this can even happen. It is critical to the new bone formation as well as configuring the shape of the bone. Then you have the medullary cavity. This is the cavity of the shaft lined by a thin membrane called the endosteum and contains our yellow marrow, also our fat here. So this is an area that is involved in the formation of your red blood cells and your white blood cells. So now we get into the discussion of the two types of bone tissue that I've mentioned today, and that's the spongy bone and the compact bone. So spongy bone forms the interior of small bones, skull bones, and the epiphysis in our long bones. It is softer, it is weaker, and more flexible, and has those characteristics. It is highly vascular, and vascular, of course, means blood supply. So it contains a red bone marrow. And remember what happens in your red bone marrow, that's where your hematopoiesis happens, and hematopoiesis is the production of our blood cells. We have a trabeculae, that's the rods and the plates that form a mesh-like framework and contains numerous open spaces. So again, it's filled with red bone marrow and it functions in hematopoiesis. That's our spongy bone. Now our compact bone forms the wall of the diaphysis and a thin layer over the epiphysis. Tightly packed bone with no open spaces is very strong and provides strength. So this supports the whole body. It protects organs, it provides levers for movement, and it stores and releases chemical elements, mainly our calcium. So remember, your compact bone is your stronger bone holding our weight. So microscopic anatomy of the bone. The osteon is the structural unit of a bone. So the osteon is the primary structure of the hard outer layer of bones. You have the central canal, that's the opening in the center of the osteon that carries our blood vessels. So it houses our blood vessels and our nerves. The Volkmann's canals runs perpendicular to the central canal. So any of the various canals in the bone that transmit blood vessels from the periosteum into the bone occurs here in the Volkmann's canal. An osteocyte is a bone cell. So this is a cell that lies within the substance of fully formed bone. It occupies a small chamber called the lacunae. The lacunae is the cavity containing the osteocytes. The lamellae is the rings around the central canal and is the site of the lacunae. Then the canculi is the tiny canals that radiate from the central canal to the lacunae, and then they form a transport system for our nutrients within our bones. Now, bone formation. Bone formation is called ossification. Bones are formed by replacing connective tissues with bone tissue. So if it were not for ossification, you would be a soft mound of just blood, water, and flesh. So ossification is the gradual transition from a cartilage template to a bone. This is the process of laying down new bone material by cells called osteoblast. And we're going to get into osteoblast in just a moment. So in embryos, the skeleton of the body begins as hyaline cartilage and the skull bones begin as connective tissue membranes. So during embryonic development, the skeleton remains primarily cartilage to form the basic framework of the body. So after the basic structure of the embryo is formed, that is when bone begins to be deposited in one of two ways, either intramembranous ossification or endochondrial ossification. So here, during development, these membranes and cartilages are replaced by bone through two processes. You have intramembranous ossification, which is the skull. Connective tissue is replaced by bone. Or you have endochondrial ossification, where the long bones and most of your other bones, which were hyaline cartilage, is replaced by bone. So during intramembranous ossification, this is primarily in the compact, flat bones of the skull. The skull and the mandible of a fetus are first laid down as a membrane. Then osteoblasts attach to the membrane, ossifying from the center of the bone outward. The edges of the skull bones don't completely ossify to allow for molding of the head during birth. So that is what is called our fontanelles, or our soft spots. And then endochondral ossification, this begins about the 5th week after conception. Calcification takes place, hardening of the bones, and then of course absence of this can cause a child to have very soft, brittle bones, resulting in a disorder that you might have heard called rickets. So blood supply brings osteoblasts that attach to this cartilage. So again, this is just a bone formating process called ossification. So there are 2 types of cells that I've mentioned to you in this bone formation or ossification process. That's osteoblast and osteoclast. So osteoblast is the bone forming cells. They deposit bone matrix around themselves and become embedded within the lacunae. So osteoblast is a cell that makes bone, and it does so by producing a matrix that then becomes mineralized. Bone mass is maintained by a balance between the activity of osteoblasts that form bone and osteoclasts that break it down. So osteoclasts are the cells that remove bone as it develops and grows. So the osteoclasts are cells that nibble at and break down the bone and is responsible for bone reabsorption. So in a normal bone formation and bone reabsorption are closely coupled processes involved in the normal remodeling of bone. So in other words, your osteoblast and your osteoclast need to work at the same rate, because if you have overactive osteoclast, then they are nibbling away at your bone too rapidly for your osteoblast to come lay down new bone. Well, then you result in osteoporosis, where we have the weak, fragile, brittle bones, because the bone reabsorption from the osteoclast breaking it down exceeds the rate of bone formation from the osteoblast, and again results in a decrease in bone mass and bone mineralization. All right, bone remodeling. So bones are continually changing throughout life. This occurs by the removal of calcium salts by osteoclast and by the depositing of new bone matrix by osteoblast. So bone remodeling is a continuous process of this reabsorption and formation, maintaining our normal bone mass. So normal bone mass indicates healthy bones that are strong and free from problems like osteoporosis. Bone remodeling is a process that goes on inside the body as long as the body is living. So cells that play important roles, again, are your osteoclast, that's breaking down and reabsorbing bone, and then osteoblast, that is vital in the formation of bones. And then osteocytes, these send signals that bones are being exposed to stress and injury. So constant remodeling allows bones to perform many functions, including structural support to the whole body and storage sites of calcium. Old bone is being replaced by new bone during the remodeling cycle. And in adults, this occurs at a rate of about 10% each year. So bone remodeling occurs in response to 2 factors: calcium levels and physical activity. So calcium levels, hormones are released when needed to maintain blood calcium levels. So your parathyroid hormones secreted by the parathyroid gland, when calcium levels in the blood are low, this is going to activate your osteoclast. So what that's saying is when you do not have adequate amounts of calcium, we know calcium is good for our bones, and that comes in many other forms besides just drinking milk. That can become, green leafy vegetables and lots of other healthy foods give you calcium. A vitamin supplement gives you calcium. But when your calcium levels are low, that makes your osteoclast activated. Now remember what the osteoclasts do. They nibble away. This is the cell that nibbles away at your bone and reabsorbs it. So that's taking bone away because your calcium levels are low. Calcitonin secreted by the thyroid gland when calcium levels in the blood are high activates your osteoblast. So that's why you need your calcium levels good, because you need that osteoblast activated, because remember, that's our cell that lays down and gives us new bone in replace of what your osteoclast took away. Physical activity. So increased physical activity causes the density and volume of your bones to be maintained or increased, while inactivity results in a decrease of bone density and volume. So you don't use it, you lose it. So make sure that you're always exercising your bones, walking, lifting weights, doing some kind of physical activity to keep your bones good and strong and healthy. Divisions of the skeleton. So you have the axial skeleton and you have the appendicular skeleton. So the axial skeleton, that's the main part of the body you can see there. It consists of the bones along the longitudinal axis of the body that support the head, the neck, and the trunk. You've got the appendicular skeleton here. That's more of your arms, your legs, your clavicle, your scapula, and your hips. This consists of bones of the limbs and the girdles. All right, you've got the paranasal sinuses. This is the hollow portions of your bones within the skull, and it functions to lighten the skull and amplify your voice. You need to know the hyoid bone, and the hyoid bone is the only bone that does not articulate or touch or join another bone, and it is the base of the tongue. You can't see it here on this photo, but if you were to turn the skull over, or if you were to look at the skull that is on the skeletal system in our lab room, you would see the hyoid bone. It almost looks like little vampire teeth. It's a little U-shaped bone at the base of the tongue there. The fetal skull fontanelles, I've mentioned those to you back when we were talking about how the fetus goes from cartilage to bone. But our fetal skull have fontanelles. These are fibrous membranes connecting the cranial bones. It allows the fetal brain to grow in the skull. Obviously, in that first year of life, the brain expands and grows, and we need those soft spots, which are the fontanelles, which are the open areas where the skull has not fused together. We need those so our brain has room to expand and grow. And then also, of course, another reason that we have fontanelles is to allow for the fetus to come through the birth canal. The vertebral column, the vertebrae are separated by intravertebral disc composed of fibrocartilage, allowing shock absorption and bending of the spine. So we need to understand that we have different vertebrae, and they're referred to as the cervical vertebrae. So that starts at the very, very top, and that's the first 7. That is your cervical vertebrae. C1 is called your atlas, and that allows you to like nod yes up and down with your head. And C2 is called your axis, and that allows you to move side to side like you're saying no. Then you have the thoracic vertebrae, which is the next 12. Then you have the lumbar, which is the next 5. And then you go on down to the sacrum, which is 5 fused vertebrae, and the coccyx, which is the 4 fused vertebrae at the very, very tip. So some abnormal spine curvatures that we'll see. Scoliosis, that's where the spine curves laterally. Kyphosis, the excessive outward thoracic curvature of the vertebral column causing the hump in the back. And then lordosis is the lumbar curvature, which is extremely inward. Joints are articulations or junctions of bones. You have immovable joints called synarthrosis joints. They are tightly joined and are separated by a thin layer of fibrous connective tissue called sutures. So an example would be your skull bones. So immovable joints, these are placed in the body where 2 bones are joined together, but where little or no movement is normally possible and where no joint cavity exists. Example would be the joints in the pelvis or joints between the teeth and the mandible. Slightly movable, called amphiarthrosis joints, are separated by cartilage or fibrous connective tissue. An example being the vertebrae separated by intervertebral disc, or the symphysis pubis, which is the cartilage area in between the pubic bones that expand for childbirth. Freely movable joints, called diarthrosis joints. These are more complex, composed of a joint cavity. And this would be like your knee, your hip joints, your shoulder, your elbow, that type of thing. Parts of a joint, we have the articular cartilage. This is the hyaline cartilage that covers the end of the bones. where they come together to form joints, enables the bone to glide over one another with very little friction. Now, this can be damaged by injury or normal wear and tear, so cartilage does not heal itself. So doctors have surgical procedures to stimulate the growth of new cartilage. Joint capsule formed from ligaments and encloses the joint cavity. This is a thin fibrous sac containing fluid which encloses a joint. The fluid provides lubrication for bone movement. Joint cavity lined with synovial membrane and filled with synovial fluid. Also contains fluid to reduce friction by lubricating the joint. Reinforcing ligaments. These are joints that are reinforced and strengthened by a number of ligaments. Surrounds the joint to give it extra strength. The bursa is sacs found within and around joint cavity filled with synovial fluid to reduce friction between the bones, and this provides a cushion between the bones and the tendons and muscles around a joint. So this helps to reduce friction between the bones and allows free movement. And that's just a picture of the parts that we just talked about of a joint. Types of synovial joints, you have the gliding or plane joint. This is between small bones that slide past one another, found in joints between our carpals. So gliding permits a wide range of mostly sideways movement as well as movement in one direction, such as your wrist and your ankle. Condyloid allows movements in two planes, side to side, back and forth, found in joint carpals and radius and the ulna, found between the metacarpals and the phalanges. So the condyloid is metacarpals, the bones of like the palm, the phalanges, the bones of the fingers and the toes. Hinge allows movement in one plane, so back and forth movement found in the elbow, knee, or between the phalanges. So like a hinge of a door, which permits movement in one plane only. Like how you just, you can move your elbow back and forth. That's in one direction. We have the saddle joint. Occurs where the ends of the bones are saddle-shaped. Movement is side to side and back and forth. Occurs between the trapezium and the metacarpal bones of the thumb. So movement in two planes here in the trapezium or the carpal and the metacarpal of the thumb. So again, wrist and palm. Pivot allows rotation in a single plane. Example is the rotation of the atlas on the axis. Now remember, that's your neck. That's your C1 and your C2. The ball and socket joint occurs where a head of the bone fits into the cavity. It is freely movable. Rotation in any plane, and your example here is like your shoulder, your arm, being attached there at your shoulder, and all in the scapula, and then also in your hip, where the femur bone is attached to the hip bone. We get into fractures. Fractures are broken bones. You have compound, which is a broken bone where it breaks through the skin, and a compound fracture is also known as an open fracture. This is an injury that occurs when there is a break in the skin around a broken bone. In order for an injury to be considered a compound fracture, the outside air, meaning dirt and bacteria, must be able to get to the fracture site without a barrier of skin. Simple is a bone that does not break through the skin, so a break that does not form an open wound in the skin would be a simple fracture. And this is just some pictures here of different types of actual fractures, and you can see the difference in where the bone actually is broken. So a couple other notes: compound being a broken bone which protrudes through the skin. Simple, a bone does not break through the skin. Incomplete, this is a bone that is not broken completely through. Green stick, the break is only on one side of the bone. The bone is bowed outward. Fissured, the break is a lengthwise split in the bone. Comminuted, the bone is broken into several pieces. Segmental, only one piece is broken out of the bone. Transverse, the break is at right angles to the long axis of the bone. Oblique, the break angles across the bone. Spiral, the fracture line spirals around the bone, so it's a twisting type of break. Bone disorders, you have osteomyelitis. This is the inflammation of the bone and the bone marrow caused by bacterial infection. So osteomyelitis, risk factors could be diabetes, poor blood supply, recent injury, use of illegal drugs. Infection may go to the bone from the infected skin, muscles, or tendons next to the bone. So this could occur under a skin sore, possibly. An infection could also start in another part of the body and spread to the bone through the blood. Osteoporosis, weakening of the bones due to the removal of calcium salts. Remember, this is where your osteoclasts are overactive. So bones are very weak and brittle, so much that a fall, mild stress like bending over or coughing could even cause a fracture. This occurs when the creation of the new bone doesn't keep up with the removal of your old bones. So in other words, your osteoblast, which is giving you new bone deposits, can't keep up with the osteoclast removing the old bone. Osteomalacia, which is called rickets. This is a disease of children that is caused by a deficiency of calcium salts in the bone. The child has a dietary deficiency of calcium and or vitamin D, and as a result, the bones soften and cannot support body weight. And one of the major characteristics is the bowed out legs. So rickets, vitamin D helps the body control calcium and phosphorus levels. So if these levels become too low, this leads to soft bones. So vitamin D is absorbed from food or from sunlight. So lack of vitamin D could be from lack of sunlight. So people who live in climates with little sunlight, or maybe lactose intolerant or vegetarian, that type of thing, may lack vitamin D and could, of course, develop rickets. Osteoarthritis, this is the most common chronic degeneration of the articular cartilage, causes pain, swelling, and restricts movement. This is when the protective cartilage of the ends of your bones wears down over time. No cure exists, but it does worsen over time. Treatment can slow the progression down and, of course, relieve symptoms only. Rheumatoid arthritis, this is the most painful and crippling type of arthritis. It is an autoimmune disease in which the body's immune system attempts to destroy synovial membranes. The synovial membranes thickens, synovial fluid accumulates, causing swelling, and the articular cartilage is destroyed, and fibrous connective tissue invades the joints, ossifies, and makes the joints immovable. So this affects small joints in the hands and the feet. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. So this is an autoimmune disorder where your immune system mistakenly attacks your own body's tissues. Usually occurs after the age of 40, and treatment is just simply controlling the symptoms. And then gout. Uric acid accumulates in the blood and is deposited in joints, mainly the great toe. So gout is characterized by sudden severe attacks of pain, redness, and tenderness in your joints, often the joint at the base of the big toe. So women are more susceptible after menopause, and the big toe will have attacks and feel like it is on fire. It is caused by having a high level of uric acid in the body, and this causes the joint to swell and become inflamed. The exact cause is unknown, but gout may run in families and be hereditary. It is more common in men and then in women after menopause and people who drink alcohol. It may develop in people with diabetes, obesity, kidney disease, leukemia, or even anemia. Homeostatic imbalance of your joints. You can have bursitis. That's an inflammation of the bursa caused by excessive use or injury. Dislocation is a displacement of bones forming a joint. Pain, swelling, and reduced movement are a result. Herniated disc. This is a condition in which an intervertebral disc protrudes beyond the edge of a vertebrae. Ruptured or slipped disc is the same thing. It is caused when excessive pressure is put on the vertebral column, and it compresses the disc to the point where it bulges outward. So the disc can press on a spinal nerve and cause a lot of pain. And then you have a sprain, which is the tearing or excessive stretching of the ligaments and tendons at a joint without dislocation.